Did you know that lung cancer is one of the most common and serious types of cancer? It's a reality many face, a disease that forms when cells in the lungs start to grow uncontrollably. This growth can spread beyond the lungs into other parts of the body, a process known as metastasis, creating a life-threatening situation. Globally, lung cancer takes the lead as the most prevalent form of cancer, making it a significant public health concern. Its severity is underscored by its high mortality rate, responsible for the most cancer deaths worldwide. But it's not all doom and gloom. With understanding comes power, and that's what we aim to provide. Knowledge about this disease, its symptoms and risk factors, coupled with the importance of early detection, can be a game changer. In the next few minutes, we will delve into the symptoms, risk factors, and the importance of early detection. Together, we can fight lung cancer. So, what are some of the symptoms of lung cancer that you should be aware of? As diverse as they may be, these symptoms often go unnoticed because they can be mistaken for less serious conditions. They include a new cough that doesn't go away, or changes in a chronic cough or smoker's cough. You may also cough up blood even in small amounts. Frequent respiratory infections such as bronchitis or pneumonia could also be signs of lung cancer. Other symptoms can mirror common respiratory ailments like wheezing or shortness of breath. Changes in your voice, such as hoarseness, could indicate lung cancer too. Unexplained weight loss and loss of appetite are more general symptoms that might not immediately raise a red flag. Chest pain that worsens with deep breathing, coughing, or laughing might be another warning sign. And finally, bone pain, though less common, could also be indicative of advanced lung cancer. Remember, persistent symptoms should never be ignored. Always consult a healthcare provider if you experience any of these. Now let's talk about the risk factors and how you can reduce your risk. Risk factors are conditions or habits that make a person more likely to develop a disease. In the case of lung cancer, the primary risk factor is smoking. Each puff of smoke not only fills your lungs with harmful chemicals, but also increases your risk of lung cancer. Whether you're a light smoker or a heavy smoker, the risk is there. Quitting smoking is a powerful step towards reducing the risk of lung cancer. It's a challenging journey, but one that's worth every effort. If you're a smoker, it's never too late to quit. And if you've never smoked, don't start. But smoking isn't the only risk factor. Exposure to secondhand smoke, even if you're not a smoker, can increase your risk. That's why it's important to maintain a smoke-free environment at home and in your workplace. Radon, a naturally occurring radioactive gas, is another risk factor. It's invisible, odorless, and tasteless, but it's there in our environment and can increase the risk of lung cancer. Ensuring your home is radon-free is a crucial step in prevention. Exposure to certain chemicals, like asbestos and diesel exhaust, also increases the risk. If you work in an environment where you're exposed to these chemicals, take the necessary safety precautions. Quitting smoking is one of the most effective ways to reduce your risk of lung cancer. But remember, non-smokers can get lung cancer too, so stay informed and be proactive about your health. Why is early detection so crucial in lung cancer? This question brings us to the heart of our discussion today. Early detection, quite simply, can mean the difference between life and death when it comes to lung cancer. When lung cancer is identified at an early stage, it's far more treatable and the chances of survival are significantly increased. Early-stage lung cancer often hasn't spread beyond the lung, which makes it easier to remove or treat with radiation therapy. But how do we achieve this early detection? Regular checkups and screenings are key, especially for those at high risk. If you're a smoker, or if you've been exposed to secondhand smoke, radon, or asbestos, these screenings become even more critical. And let's not forget the importance of paying attention to our bodies. Persistent symptoms like a new or worsening cough, coughing up blood, recurrent respiratory infections, wheezing, voice changes, unexplained weight loss, chest pain, and bone pain should never be ignored. These are your body's way of raising a red flag, a signal that something is not right. It's essential to consult with a healthcare professional if you experience these symptoms. Remember, your health is your wealth. It's not something to gamble with or take lightly. Early detection can be a game changer in the fight against lung cancer. Stay vigilant and prioritize your health. Because when it comes to battling lung cancer, time is of the essence and every moment counts. In conclusion, it's crucial to stay informed about lung cancer. Remember, the significance of early detection cannot be overstated. Persistent symptoms like a new cough, coughing up blood, recurrent respiratory infections, and unexplained weight loss should prompt a visit to the doctor. Risk factors, particularly smoking, need to be acknowledged, and quitting smoking is a vital step towards reducing lung cancer risk. Thank you for watching. Remember, early detection saves lives. Stay informed and take care of your health.